I'm Dr. Sharon Thompson. Good morning. Thank you for having me. And I am excited to talk to you today about AZAdvances, which is the flagship project for my company, All In Together Now. I am a practitioner of medicine, as well as a teacher of medicine. I teach medical students, I teach physician assistants, I teach nurse practitioner students. And in doing so, I recognize the confluence of two problems that we're going to talk about today. And so I developed this app that brings AI-powered diagnostic reasoning to clinicians to help them think like a professor of medicine. Here's problem one. Every American will have at least one diagnostic error in their lifetime. And this is according to the National Academies of Medicine. And that means about 12 million Americans every year. That's either a delay in diagnosis or an error in diagnosis. And this is significant because diagnostic errors have been found to be implicated in about 10% of deaths in this country. That's 1 in 10. That could be one of you. So I want to solve this problem for you before it kills you. It's the #1 cause of medical malpractice claims. Now, why does it happen? It doesn't happen because clinicians don't care or because they don't know. It happens because of some particular barriers in the care delivery system. One is cognitive overload. To get you from the problem you present with to the diagnosis, to what to do next, providers actually have to juggle a lot in their minds. They have to think about your symptom. What could possibly be causing it? What else is going on in terms of your history? They're thinking about documentation. They're thinking about your emotional needs. They're thinking about customer service. They're thinking about regulatory issues. They're thinking about confidentiality. So that can lead to a lot of cognitive overload. And another big problem that we often don't consider is that the skill that gets clinicians the ability to juggle all this information at the same time and accurately takes time to develop. Fun fact, if you have ever heard of the 10,000 hours it takes for someone to become competent at a skill, that actually came out of an article that was talking about clinical judgment. It was popularized by Malcolm Gladwell in one of his books, and that's probably where most of us have heard it, but it actually came out of a clinician talking about the development of critical thinking, clinical thinking, or clinical judgment, as we might have heard it called. And so that takes a while, but some clinicians are trained for as short as 3 years, and we expect them to have that judgment in that short time that we know, on the one hand, takes a lot of time to develop. Another factor is that clinicians have a lot of time pressure. Your provider may have a precious 10 or 20 minutes with you, whether you are a follow-up or a brand new patient they've never met before. And then we have workforce gaps, differences in training that I mentioned before, but also differences in specialty. If you're an ER doctor, you can see every kind of problem from eyes to toes. And you are expected to manage all of those things, all the things that I mentioned, the diagnosis, the symptoms, et cetera, in a specialty that you may not have seen for months or years. And so all these things can wind up creating those diagnostic errors and delays. So I developed a solution that uses AI for its best use. AI is excellent at storing information and giving information back. And so we use it for that reason. A provider puts in a symptom or a clinical question, as you see in the example here, and what AZAdvances does is it returns what should that provider do next? What questions should they ask you? How can they gather the history that follows the maxim we have in medicine? 90% of diagnosis is in the history. So you got to ask the right questions. This is the foundation for everything. So it gives the provider the questions to ask. Then it takes them to, what exam do you need to do? Now, if you come to me for an eye problem, I should not be telling you take your pants off. Doesn't make sense, right? So let's be efficient and focus. What labs and imaging do you need? Do you need an MRI? Do you need an ultrasound? Do you need a CAT scan? All those modalities give different information, and one is better for a certain part of the body than the other. Which one should you choose? AZAdvances helps you with that. It also gives you the differential diagnosis. That's doctor speak for what is the list of things that could be going on here. But it goes further than that. It also helps you figure out, let's say you are that ER doc and you were seeing this obscure thing that you haven't seen before. What do you tell the person who's in that exam room waiting for you? So it gives you notes on patient counseling. We want our practice to be evidence-based, so it gives you evidence-based references as well as clinical guidelines and some information about possible treatment options so that you can guide that conversation and adequately educate the person who came to you for help. And finally, it gives you some links on where can you send this person who is now curious or anxious to get more information so that they can be better informed as well. And this is an innovation. It's not just a reference tool. It provides reasoning, not just a lookup, not just a list of diagnoses, but it gives you a scaffolding that takes you to how to get from that symptom to the accurate diagnosis. It's real-time and context-based. It takes a few seconds to run. It can be used for education and practice. So clinicians, when they're using it, will get a great assist for the person in front of them, but it also teaches them over time. How do I think about getting from symptom to an accurate diagnosis through this process? Because it is a diagnostic scaffold and not the answer, the clinician has to be actively engaged and they remain in charge. Doesn't require any personal identifiers, so patient information remains safe and confidential. There are some other companies doing similar things. I'm not the only one, but they're very different. UpToDate is a tool that clinicians use. I don't think there's anyone who's ever been trained in the United States who doesn't know UpToDate. It is behind a paywall though, so you have to subscribe to it, and the cost is not a little bit. They are too developing a diagnostic reasoning tool. It's not yet widely available, and it's behind another paywall. So you pay for UpToDate, and then you pay an add-on for this one. So it's not very accessible. DocsGPT is from a company called Doximity, which is like social media for clinicians. So you have to be a clinician to get access. You have to be a member of Doximity to get access. Again, not widely available. AZAdvances is another private company that has been deployed in the US and around the world. It is limited though. You put in a symptom similar to mine, but it gives you only a structured differential diagnosis, a structured list of what this could be. I tried it, not so good, not to bash Isabel. Mine, Access Diagnosis, tries to do it differently. It looks at it from a clinician's perspective. What do clinicians need and what do patients need? Because that's my background, so that's my focus. So I wanted to give you just a little hint of what you get when you put in a symptom. So for this one, I put in fever, and as you can see, it tells you, when did the fever start? How long have you been experiencing it? Is it constant or does it come and go? How high has it been? These are the questions that are gonna help your clinician gather the appropriate history to get you to the right diagnosis. Then the next section it will give you is the focus exam. So you definitely wanna take the temperatures to verify the fever. What is the heart rate? Which fever can change heart rate, so that's appropriate. You're looking in the body for where you think the source of that fever might be. Now this example is not so realistic, right? People usually come with fever but this is just for illustration. And it'll give you relevant labs to try to figure out what's causing a fever. Is it a UTI? Is it a blood infection, etc. Differential diagnosis, it gives you viral causes of fever, non-infectious, and bacterial causes. The next section is the last one that I talked about in the other slide, patient counseling, references, and patient education. Finally, there's a disclaimer. This is not the decision maker. Your clinician remains the decision maker. This is simply an assistive tool. So we're keeping humans in the loop, as we say now in 2026. So what is the impact? Reducing that cognitive load and increasing cognitive safety for clinicians. Health equity is a wonderful byproduct of this app, because when we're stressed, when we're under cognitive time pressures, we use our fast thinking. Fast thinking tends to be stereotyped. It tends to be built on assumptions, and that can lead to biased care and biased outcomes. So this app will improve health equity. And also workforce readiness. So remember I talked about those training gaps, those experience gaps. This can bridge those gaps. Who's impacted? All of us. The 355 million people in America can benefit from decreased diagnostic delay and error. Clinicians can benefit from this diagnostic scaffold that reduces their cognitive load, increases their accuracy, and decreases bias. Healthcare employers can use this tool for employee onboarding, patient care, and even evaluation of employees. Educators can use it to train students, educators like me. I built it for me, but it's available for other educators as well. And even insurance payers can benefit because they have an interest in appropriate resource utilization. This app guides resource utilization appropriate to the symptom you're evaluating. So there's a lot of folks who will be impacted. In terms of traction and validation, I built the MVP for this, me who went to medical school and not computer science or IT. And that's a testament to AI and the wonders of modern technology. But we've had really good traction so far. The beta is live. I'm in conversation with 2 practices to pilot this for their employees. I actually gave a presentation. Providers came to me and said, I need this for my employees. This is really gonna help me. And then I've had some feedback from potential patients. One young woman who gave the quote about the diagnosis, she ultimately was diagnosed with lupus, but when she went to the clinician with her initial skin symptoms, she went bounce and bounce and bounce and bounce. And I said, well, let's put your original symptom into the app and see what happens. And sure enough, lupus was #1 on the differential diagnosis. So I was pleased because it didn't have to go that way, but I'm very happy that it's very accurate. Clinicians have given me excellent feedback, and so have students. So what's next for us? Again, me, went to med school, so I'm looking for a technical co-founder to help me with development and making sure that we have an app that is reliable, fast, secure, and has the architecture to scale. I'm, as I mentioned, working with clinical education sites to pilot and make sure that we are relevant, that we are relatable and reliable for education and teaching, and launching for hopefully the end of the year, a hard launch for the rest of the country. How can you help? What's my ask today? Several ways. One, you can pilot if you're an educational institution or a practice that we can use AZAdvances to assist you in your work. Partnering in terms of integrating with EHRs or with individual systems. All In Together Now is actually a 501c3 organization, so tax-deductible donations are always welcome. And of course, you can sign up for the app because your feedback is going to help make this the app that becomes the #1 tool for clinicians and for educators. We want AZAdvances to be as basic to healthcare as the stethoscope. Thank you for your attention.